Good afternoon, everyone, and welcome. I see we have about 40 people joining us today. Very exciting. I am just so pleased to be able to offer everyone on this call the warmest of welcomes to what I hope will be a very engaging and informative and supportive discussion on navigating caregiving challenges. I am Kirsten Corzini. I'm the Dean of the College of Health and Human Services at the University of New Hampshire. I am joined by several distinguished colleagues here at UNH and in the community who will be here to offer insights, wisdom, ask questions, and what I anticipate again will be first and foremost a supportive dialogue, but also a really engaging and very hopeful look at how we navigate caregiving challenges. I am most pleased to share that today's session will be moderated by Jennifer Rabelais, class of 1991, and our co-director of the University of New Hampshire College of Health and Human Services' Center on Aging and Community Living. Thank you for joining us today, Jennifer. Our expert panel of alumni and faculty will discuss the intricacies of providing optimal care for yourself or your aging family members, whether managing health concerns, promoting thriving and well-being, to maintaining open communication as you juggle all commitments. This webinar really aims to provide a holistic approach to this topic, whether you're just beginning this journey or seeking guidance to enhance your current efforts. We hope this discussion will be informative. And now, with that, I will turn it over to Jennifer. Thank you.
Thank you, Dean Corzini. I'm proud to be a part of today's webinar and really want to welcome all of our attendees today. As was mentioned, I am both an alumni of UNH, graduating in 1991, and also have been employed with UNH for almost 14 years. As co-director for the Center on Aging and Community Living, the topic of caregiving is of great importance to me. And that's really in large part because most of us throughout the course of our lives will either be a caregiver for someone or who will receive care, even if it's short term, at some point in our lives. So this is an issue that really impacts all of us at all ages and stages of our life. So with that, I want to acknowledge that we have a wonderful panel with us here today. We're going to hear from our panel first. I'm going to ask questions to our panel, but we will leave time for question and answers from our attendees. So I want to encourage everyone to put your questions in the Q&A feature you'll find it at the bottom of your screen. Feel free to put those questions in throughout the whole discussion today, and then we'll hold time at the end where I will pose your questions to the panel. So again, I want to thank you for joining. I would like to start our discussion today by asking each of our panelists to introduce themselves. And we will start with Rebecca, Sean, and then Jane.
Hello, my name is Rebecca Skye. I graduated from the UNH MPH program in 2016. That was not my start in public health. I have an over 20-year history of working in public health. I'm currently serving as the executive director for the New Hampshire State Commission on Aging. The Commission on Aging was established during the 2019 legislative session. I came on board in 2020 as the first executive director. The key charge for the commission is to advise the governor and legislature on issues related to aging. We study areas of public policy that impact older adults and annually produce a report on our findings. We do a bit more than that, including publishing a great newsletter that if you'd like to get on our mailing list, go check out our website and you can sign up for it. My office regularly gets calls from citizens seeking answers to questions that will be raised today. I'm going to suggest later in this webinar an even better place for people to call, New Hampshire's Aging and Disability Resource Centers called Service Links. But in receiving these calls, we hear many stories about the challenges of caregiving. And so I'm looking forward to hearing today's panel. Thank you.
Thanks, Rebecca. Great to be here. Hi, everybody. My name is Sean Stevenson, and I am a graduate of UNH Health Management and Policy 1995. Proud to say that my mother also graduated from UNH, and my wife also graduated from UNH, and now my daughter is a junior at UNH. So Wildcat pride here. So great to be here. My whole career has actually been post-acute care, otherwise post-hospital care, assisted living, independent living, long-term care, and short-stay rehab services. Worked for several long-term care corporations in really focusing on the operations and senior executive level, and recently decided to start a new journey and get into the ownership side of long-term care and have a building now here in the Granite State, and actually will be soon growing in early next year. So excited to be here as well. Quickly, I would say it's funny, as friends and friends of friends and family learned of what business I am in, I am getting more and more volume and phone calls and questions for help, and it really gets down to really planning. So I have a lot of passion about this, and I'm excited. Thank you.
Thank you, Sean. Hello, everyone. My name is Jing Wan, and I'm an assistant professor at the College of Health and Human Services. My career is driven by a deep passion for global research focused on enhancing the well-being of older adults and their caregivers. And my work primarily focused on improving care quality, well-being, and health equity for persons with dementia and their caregivers. At the core of my interest is understanding and advocating for person-centered care for older adults. I'm particularly intrigued by exploring ways to meaningfully engage older adults in nurturing, caring relationships. And thank you for this opportunity to share my work and perspectives with you all today.
Thank you, Rebecca, Sean, and Jing, for those introductions. Love that Wildcat pride, Sean. So it's clear as we listen to those introductions that we have a broad range of expertise and experience on our panel today, and I'm so thrilled to be spending this hour with you. I'd like to start our time off with a question around planning. And Sean, you mentioned actually in your introduction planning. So I would like to ask you, how can individuals plan and determine the most suitable caregiving arrangements for their particular needs?
Sure, great. So there's a famous former Yankee, Yogi Berra, once said that if you don't know where you are going, you're going to end up someplace else. and really what he's really referring to is actually planning. Healthcare can be a long journey, just as life, and the more planning you do, the more prepared you'll be, right? This journey can be emotional, it can be financially significant, and ultimately it can be very time-consuming. So great start to everybody who's on the webinar. You're already ahead of most people, so good work. I'd say think of healthcare planning for yourself, or if it's a loved one, really as a continuum of care that is really designed to support your or loved one's transition from being completely independent to different levels of dependence, okay? For really planning purposes, without overwhelming everyone, I try to really just simplify it to start with really 3 areas. And I have my timer here, so I'm going to go quick so I behave. I would say 1 is really, sounds obvious, but it can be challenging. Start the conversation. whether it's with yourself or if it's with a loved one, the best situation is that it is collaborative, really an open sharing of wishes and all necessary critical information. This includes what I always ask, what is most important to you or your loved one? What's most important? And so you get into wants and needs, geography, lifestyle, being home, not being home, providers, and social. That's all a big part of it. 2, not always a comfortable topic, but it's the reality. Get and organize the financial picture. A clear sense of assets, liabilities, cash flow. There are lots of articles out there about that, webinars out there about that. Of course, paid attorneys, financial planners, etc., who know how to help with this and ultimately how to also protect it and really maximize. Finally, 3 is to, and this is always a scramble for folks, and if you prepare, you're going to be okay, obtain and organize your healthcare or your loved one's healthcare legal documents. So areas of like examples are powers of attorney, or if it's healthcare, financial or durable, living wills, and healthcare proxies. So that's my recommendation to start the big 3: talk, financial, healthcare legal documents.
Thank you, Sean. That is really helpful to frame up this, where do we start? And Rebecca, I would love to hear from you about any additional considerations that individuals and caregivers might think about when planning for long-term care.
Yes, I'd just like to reiterate the importance of planning ahead and talking with another individual. Fewer than half of adult surveys say have a conversation with another about this topic. And if you are a caregiver, be brave and discuss various scenarios, best case and worst case. Explore all sorts of options. It's just not about where you're going to live and where you're going to get physical care. It's about sometimes you need to know about transportation options and food acquisition options and that sort of thing. And it's important, if you are currently a caregiver, to not just think about this, about the future of the person, to have these conversations with the person that you are caregiving, but also to think about yourself, because what would happen to the person you're caring for if something were to happen to you? And also you need to know, what would you prefer? And as Sean mentioned, there are key considerations. You got to think about the quality of of the various options, and you also have to think about affordability. CMS has a great website, Care Compare. It has a star rating system for nursing homes and other healthcare providers. But what I find it even more useful for is you put in your zip code, and up provides all the providers in your area. So that's a great start of understanding what's the realm of possible. A good indicator of quality is the registered nurse staff hours per resident per day, and that data is available for all the providers that are on that website. And when we think about assisted living, one consideration might be which ones accept Medicaid choices, Medicaid, which in New Hampshire is the Choices for Independence as a payer source. And I say this because some people do spend down their assets in assisted living. And sometimes once that happens, once those assets are depleted, they're forced to move. So you can find out which facilities take Medicaid. One way of finding out which facilities take Medicaid is by calling the New Hampshire Office of Long-Term Care Ombudsman. They do have a full list of assisted living facilities and know which ones have Medicaid beds. So, and the last thing I just want to say is you don't have to do this in a vacuum. There's lots of people to help you out there, to help you brainstorm options. I mentioned it already, ServiceLink in New Hampshire. They have a toll-free phone number and 13 offices throughout the state. There are separate agencies that support individuals and families dealing with developmental disabilities. And then if you're in another state so what are your options? Call your local area agency on aging. They perform the same services in other states.
Rebecca, you mentioned you shared a lot of great resources, but I want to go back to something you said really at the beginning, which was the importance of caregivers thinking about themselves. So I want to ask you, how can caregivers prioritize their own self-care, given that there's so much to focus on when caring for someone else?
Well, caregiving is a labor of love, but it also can be physically and emotionally demanding. Many people who are caregivers don't self-identify as a caregiver. When people don't see themselves as a caregiver, it reduces options and support. So number one in my book is just recognizing that when you are a caregiver and helping others who are in that role to recognize that they are in that role. If you help a loved one or a friend with chores, meal prep, cleaning, grocery shopping, providing rides to appointments, assisting with healthcare decisions, assisting with bill paying, making phone calls, and let alone the physical hands-on things such as bathing and assisting with eating, you're a caregiver. So recognize that. And second thing I wanted to say about the topic is the number one job of a caregiver is self-care, because if you're not okay, you cannot take care of another. And even if you aren't okay in the moment, you have to be vigilant to keep yourself okay over the long haul. So those are my two top things.
Thank you, Rebecca. And Jing, given your expertise, I would love for you also to add on what are some of those effective strategies for balancing the caregiving responsibilities with other personal and maybe even professional commitments?
Yeah, sure, Jennifer. So I believe many of you are already caregivers of an older family member. And if not, imagine yourself responsible for the daily care of an older family member, and think about, how do you think you would feel in this caregiving role on a day-to-day basis? And consider the range of emotions. What strategies might you use to cope with negative emotions? What changes might you need to make to your daily routine to accommodate your caregiving duties? How would you manage to balance your personal, professional, and caregiving responsibilities? And what would you turn to for support in your caregiving role? And how comfortable would you feel asking for and accepting help? And we had a study focusing on dyads, persons with dementia, and their family caregivers. And we first had a paper on understanding their dyadic experiences. And then this finding informed another one to have an evolving understanding of person-centered dementia care in home-based settings. And they both speak to the self-care of caregivers, particularly in the context of caring for persons living with dementia. And as many of you may have known about person-centered care, it's a gold standard in dementia care. It's an approach that fundamentally views individuals receiving care as whole person, rather than as a collection of symptoms or medical problems. And it emphasizes understanding and respecting the unique preferences, values, and needs of each person. And some of the keywords would be personhood, autonomy, and dignity. And just as what Rebecca has said, firstly, it's crucial for caregivers to recognize the importance of self-care. It's not selfish, it's essential. And this can be facilitated by setting realistic goals and expectations. We have participants sharing with us that they postpone their own doctor's appointment, they ignore their own chronic conditions. You have every right to, and you should take good care of yourself first. And understanding that it's okay not to be perfect, and acknowledging that some days will be better than others helps in maintaining a balanced perspective. And some of our participants even said that, I am taking a break only to be able to provide better care for my spouse. So it just reminds me of like putting on your oxygen mask first before helping others. And that is the only way for my mom to kind of sort of accept that you put on your own oxygen mask before helping the kids. Like the only way. And we could use that like when we tailor the intervention to kind of facilitate the self-care. But we also need to think about that mindset here. And it's true that caregivers can only provide good care when they maintain their own well-being. But we also need to think about needs a shift of the mindset here. You can take care of yourself just for yourself, even if it's not to be able to provide better care. And our research also emphasized the importance of a support network. It has been repeatedly shared by our participants that I don't want to burden my children. They're so busy. They have their own family to take care of. They have their work. I don't think healthcare aides can provide the same quality of care that I can to my husband. But utilizing respite care services, it can give caregivers a much needed break. It's important for them to stay connected with their interest and professional commitments. This might mean setting aside specific time for work, hobbies, or socializing. And caregivers need to have access to emotional support, whether through support groups, counseling, or just simply talking to friends and family. And we also have like articles about how to kind of address the stigma associated with counseling, especially with family counseling. So it's really about finding a balance between meeting the needs of caregivers and persons with dementia. But honestly, there may never be a perfect balance, but striving for it is a journey, and needs continuous adaptation. And ensuring that persons with dementia have their voice heard, their caregiver's voice heard, and actually working with them is an essential focus. So at last, back to our questions asked at the beginning, caregiving is a complex and dynamic journey, and recognizing the importance of self-care and seeking support are not signs of weakness or selfishness, but rather an indicator of strength and wisdom.
Thank you, Jing. Those are great points. And I think that's something that we all struggle with. And so I love your analogy about putting your oxygen mask on first. That's a great analogy for this. And so in hearing that there are many ways that a caregiver can take care of themselves or perform self-care, and that can look differently for a lot of people, but I am also hearing that one way that you can do that is by giving yourself permission to access resources and supports. So I want to kind of circle back around on our earlier conversation where we started to go there, and I saw actually there's some interest in learning more about some of the resources, and we are beginning to post those in the chat feature. So I'm wondering, Rebecca, if you could talk a little bit more about community resources that are available to support caregivers.
Yes, absolutely. And you know, in New Hampshire, we have a lot of pride around that rugged individualist mindset that yeah, there's all these services out there, but you know, there's always somebody else in greater need than myself, so I shouldn't take advantage of them. And that's just not the case. I personally, I'll just let you know, I was at the library the other day, and I was, as I usually do, walking past the large print books because I was saying, oh, you know what, that's, you know, somebody else needs that more than I. And then I finally opened up one of the books and I said, wow, this font's even still too small for me. So those books were for me. And I just want to say that yeah, these services are available for everyone, and that it is not just reiterating, it's not a sign, it's a sign of strength to take advantage of them. So New Hampshire, I had mentioned previously, New Hampshire's Aging and Disability Resource Centers, the service links. I believe the link is in the chat. They also have a toll-free number, 1-866-634-9412. I'm sure that will get in the chat too. But the state has a website. If you Google service links, it not only describes the service link resources and services offered by the organizations that provide these services, but it also has an online searchable database of resources. New Hampshire Care Path is a website also that's available on the state websites. And it's a good resource for helping one suss out the possible needs and available services that are out there. Another in-state resource is Dartmouth Health has an aging resource center. And if you're seeking services in another state, I've already mentioned the Area Agency on Aging. So just as far as caregiving resources, because we were just talking about how self-care, you can access through the service links. There is a respite program that if you need a few hours to take care of your own needs, or more than that, by calling service link, you can access resources to have somebody be there with the person that you are a care partner with and providing care for. They also have links to can share with you also various peer support groups. They can help you figure out the access to other things if you need help with foods, food preparation. There's Meals on Wheels programs they can connect you with. They can connect you with transportation programs to get rides for various services. You need help deciding about your Medicare options. ServiceLink is the place you call. They are a great resource on a variety of issues. So just want to put that out there. Also, because we have touched on dementia, Alzheimer's Association is a fabulous resource, and they have online peer groups and experts that are available all the time to answer any question that you might have. So
Thank
those
you.
are a few of my favorites.
Thank you. That's a great list, Rebecca. Thank you. And Sean, from your perspective, I'd love to give you a chance to add any additional resources.
Sure. Yeah, and I guess Rebecca did a fabulous job there. It was a lot of material. I think that the term respite came up. I think it's also important that there are a lot of independent living, assisted living, and long-term care centers who also offer respite services, where it's actually it's a win-win, really. It's an opportunity, I think, for if folks really need a break, or if folks want to take a vacation, you know, they have a wedding somewhere or whatever, and they can't care for mom, they can actually go to even a potential future, you know, home and setting. And so there's opportunity to be able to, you know, let mom try it out, you know, and see if that's a suitable, comfortable environment for him or her. I think maybe just more of also just to more be warned. I think Rebecca brought up a lot of really great, you know, government, charitable, not-for-profit services that can really help and can be a really solid referral source and a really good resource. I would say also, there are also some on the other side, when you Google for help, there's also businesses out there that will also be happy to serve you at a price and be able to give you thoughts and ideas. And I would just say to just approach those with caution, because a lot of who they're going to maybe refer them to are companies and services who have paid for them to do the referral, you know, or are paying them to do that referral, if that makes sense. So it's just more of, in the end, you know, as much as you can to do your own research and do your due diligence on that. Yeah, I think most of it was covered. I know we'll get into a little bit around paid services and other technology and how that can also support in balancing and helping. So we'll get to that.
Thank you, Sean. And you brought up respite, and really several times I think we've heard about the importance of taking a break. And that can be really important in preserving the relationship with the person that you're caring for, knowing when it's time to kind of step away for a moment and take a break. So I really want to pivot to a conversation about, and Jing, maybe this is a question for you. How can caregivers maintain a positive and healthy relationship with the person they're caring for?
Sure. Thank you, Jennifer. We talked about person-centered care, and some researchers adopted the term relationship-centered care, and it tends beyond the individuals to include the importance of relationships, and acknowledge that the quality and nature of relationships between patients, family, and healthcare providers significantly influence care outcomes and experiences. And think about it, some of the keywords might be interaction, communication, and collaboration. And caregivers, a lot of times they're referred to as care partners. And then care receivers or care recipients, they are referred to as persons living with dementia or persons living with Alzheimer's disease. So kind of this change of the terms to refer to them also kind of shows about, it's not just about caregiving, care receiving. It's kind of, they can work together. They can have collaborative work together to kind of like better care outcomes and better relationships. And as I mentioned, self-care is an essential part of promoting a healthy caregiving relationship. And we have this study that develops care partner assisted oral health intervention. for persons with cognitive impairment. And it highlighted the importance of understanding the unique experiences and challenges faced by individuals living with cognitive impairment. And caregivers need to acknowledge the frustrations and difficulties their family might be experiencing due to their conditions. And this understanding fosters patience and compassion, which are key components of a positive caregiving relationship. We also find that effective communication is vital. Caregivers need to use clear, simple language and maintain a calm, reassuring tone. And understanding nonverbal communication cues and being patient in communication can greatly help in reducing misunderstanding and fostering a strong bond. And like some of our participants said, that I need to stop being bossy. And others share that I just do the brushing teeth together with him or her instead of asking, just like, oh, did you do it right? Oh, you did it wrong. Like I just do it together with him or her, and then we ended up doing it together. And that brings to the importance of involvement, involving individuals with cognitive impairment in decision-making as much as possible. This inclusion helps maintain their sense of autonomy and dignity, even just small decisions related to daily routines, or like how much toothpaste you would want, or like health interventions can help make a significant difference. So establishing a consistent routine is also necessary for like all these like daily routines, including like our health intervention, can provide a sense of security and familiarity for those with cognitive impairment. As we all know, a predictable environment can reduce their anxiety and confusion, and contributing to a more harmonious and positive caregiving relationship. So we also found that caregivers need to be well-informed and trained in handling specific needs of their care recipients, and education on disease process, behavior management strategies, and health intervention techniques, including communication techniques, can empower caregivers, making them more confident in their role. We kind of call them as they are leaders, they are adaptive leaders, and it's a care partner assisted intervention. So I think by maintaining their own physical and emotional well-being, caregivers are better equipped to provide positive and effective care. And just as back to what we talk about, the importance of self-care of caregivers or care partners.
Thank you, Jane.
One thing,
Yes, John.
yeah, one thing I just want to add quickly, as Ian was talking, it got me thinking about just quickly one, and it sounds simple, but one word that a couple words really that I stress as far as our professional caregivers, but really it applies to, to everybody that is a caregiver, that Rebecca so well defined, I think is really compassion. It really comes down to that word, compassionate care. And I think it's hard to teach that, but I think the other word is really, it's not sympathy, it's actually empathy. And I think the difference there is what I stress is when you have empathy, it's not just walking by somebody and feeling bad for them. Empathy is really trying to put yourselves in their shoes and to try to understand what they're really going through and experiencing it, and then actually acting on it, and doing something about it and really caring for them. And so, it's hard. I know that there's fatigue and everything that we've been talking about self-care, but I think reminding yourself about having compassion and having true empathy, I think that's going to go a long way for you.
Great point, Sean. And I saw Rebecca, you came up mute.
Well, it's just so well said. Both Jing and Sean just did a fabulous job, and it is just a constant guard against that. You're in sometimes it feels, it feels like you're in an over-under relationship rather than sometimes in a partnership. And just the guarding you have to do against paternalistic behavior, that role reversal, it's really disheartening. And I find it in my own life. So this is not something that's easy to do. And it's something just to, that keeping that empathy, that compassion, and finding ways to empower the person that you are care partnering with. And I'm using that word care partner. There's a woman named Teepa Snow. She's an internationally renowned person who works in this field and promotes positive care. She actually has what she calls a positive approach to care. I know that when my husband was a care partner to his dad with Alzheimer's for over a decade, he repeatedly went and checked out her website, watched her videos, and found it so valuable as far as tools and tips for being able to employ as a care partner. And just using that word care partner rather than caregiver helps to reframe your thinking in your own brain if you start to use it a bit, and the fact that you are in a partnership and it's in a relationship. So it's labor of love. It's really hard work, and just want to put a big hug out there for everybody who's doing this work.
Thank you, Rebecca. Well said. And I think, you touched on something, the importance of how we frame things, how we talk about things really can help change how we think about things. So using something like that, the term care partner can help us shift in how we think about that relationship. So I appreciate that you shared that. And I believe we have Teepa Snow's link in the chat for those that were interested in that. I want to shift the conversation a little, because one thing we haven't done yet is we haven't talked a lot about technology, and we know technology is changing all the time and there's so much out there. So I would love to spend a few minutes understanding, and perhaps we'll start with you, Jing. How can technology play a role either in helping to preserve as much independence as possible for the individual, for an individual receiving care, or supporting a caregiver? What kind of role does technology play?
Thank you, Jennifer. I actually don't have an answer to that. I'm still exploring it, like many other researchers in healthcare and technology. And we have this amazing research project going on at our college. It's a federally funded project that develops socially assisted robots for persons with dementia and their caregivers. And I think it's in the stage of kind of like pilot testing it. We have a robot, it's in the form of a tablet on wheels. And then kind of like having this person-centered features, functions of the robot to help persons with dementia and their caregivers. And I am currently exploring in the person-centered and ethical adoption of AI-assisted robots. And I feel this is such a difficult topic. We know there are like tons of articles out there, but we know so little about it's having a robot really would reduce the caregiving burden. And what aspects of caregiving burden? We have people saying that it's actually adding to my burden, that I have to move the thing around, and then that's like not really helping. And also about for those robots, is it increasing or actually reducing the real human interactions, like the interaction between caregivers and persons with dementia? And then how can we really make it like an ethical adoption of the robots? Is person with dementia involved in the consent process? Is he like really involved in the decision making? And then there are trade-offs between monitoring, like especially in home environment. There's home monitoring, there's sensors, cameras, and then there's the privacy, there's safety, there's like the potential of reducing caregiving burden. How do we kind of like navigate like through this, like to make a decision of how we are going to use technology, how we're going to use robots for in this context of dementia care? And there's all these questions are kind of like on my mind, and I'm trying to find an answer from the literature, but I couldn't, at least at this point. And I think there are like so much need to be done. And then it needs to involve designers, healthcare providers, curies, like caregivers, persons with dementia, and even the robot, and they kind of like map out how, if there is a framework that can facilitate person-centered and ethical adoption of this technology. It was such a like rapid advancement of technology and AI.
Thank you. Thank you, Jing. Thank you for sharing that project, the robotics project at UNH. I think it is a great example of the potential, you know, and the possibilities for technology. Maybe in 1 minute, Sean, just a brief, if you want to add anything related to technology before we transition to questions.
Yeah, I mean, it's amazing, you know, what the phone nowadays can accomplish. And I think, but going back quickly, you know, really hard to find a silver lining about COVID, right? And when it was at its worst. But one of them was actually the, you know, I would say expedited utilization of technology, you know, where even just the simple term of telehealth, telemedicine, and what that can save you as far as time, and there are a lot of insurance plans now that will say if you do this appointment telehealth, it's actually free, or there's no copay, and you know, because of what it saves on the provider side and what it saves you on the transportation and everything having to do that. But even, you know, we joked around the other day, but even just, you know, utilizing Alexa in your home to be able to, you know, remind you of your next appointment or when to take your medication and all that. So there's medical alert devices, 911 necklaces, and wristbands, and there's blood sugar monitoring now, and blood pressure, and all your vital signs that you can do at home or that a loved one can do for you, and it's all available. Quickly, I would say it also is the area of medical equipment. It's not necessarily technology, but it's close to that, where it really has advanced, where there's specialty, you know, lazy boys and chairs and beds and everything that can really meet what your needs are at that time. So I mean, shoot for the stars on that. There's so much available now.
Yes, agree. And Rebecca, I wanted to acknowledge that you put a link in the chat, and thank you. So you put a link in for assistive technology in New Hampshire, otherwise known as ATN New Hampshire. And that was on my mind too. So I would appreciate that you put it in there. And it's a great resource. And we think of technology, sometimes our minds go automatically to these highly technical devices and everything. So one of the things I want to share about ATN New Hampshire is that there's a lot of low-tech devices, and so ATNH is a great resource to go to learn about all those low-tech and really creative options that can be used to help someone either maintain independence or as much independence as possible in the home, or to support caregivers. So great resource. So we've heard a lot of great information from all of our panelists. Now I want to transition to questions from attendees. And so the first question that I'd like to pose is a question that came in. Do you have any tips on interviewing potential caregivers? So how do we go about finding the right caregiver? What are some of the questions we ask when we go through that process? So perhaps maybe Sean, I'll start with you. That was not directed towards any particular, so we can kind of start with you, Sean.
Yeah, I mean, it's funny. I am always at the end, you know, a big doing your research and your due diligence, but in the end, right, you almost follow your gut with our decision-making process. I think it's really, again, with that discussion, in this question, let's talk about your mom. I think it's really like, what's most important to your mom? You know, like, what do you think is really her, you know, push points and priorities as far as that, you know, you knowing her background, and then obviously what's most important to you, that would come next. I think you try to gear your questions towards that. And, you know, I think a lot of this, it's just sort of, you know, vanilla textbook research questions, you know, what's your availability, what's your experience, but it's really trying to dig in around. What I try to do is find those areas that really can't be taught, and it's really how they're wired and what their makeup really is. So trying to figure out, you know, are they compassionate? You know, is that part there? Is there energy? You know, is there that, you know, like I said, things that you can't teach. I think that's what I would focus on, and see if you can get into in some of your questioning.
That's great, Sean. I love that you start and you centered on, you know, what's most important to the individual who's receiving care. And so I did want to add is that there are actually tools. So if we think about that, we're centering on the person. So there are person-centered tools that are available. And I believe if one were to even Google person-centered tools, you can find some, you know, worksheets and things that might help you frame a conversation around, you know, what does an optimal caregiver look like? What are some of the things that an optimal caregiver doesn't look like? You know, so what don't you want? What do you want and what don't you want? So those are also great resources. I'm gonna pivot to another question. Thank you, Sean. And so just circling back around on some of the conversations we've had about preserving relationships, any recommendations in particular? So the relationship with a spouse is a special relationship. And so a question came in about how do we, you know, preserve that relationship? How can a spouse both be a caregiver and be a husband and wife? And so, Jing, I'm going to give you that question.
Sure, Jennifer. This is a great question. I think in my study, when I was interviewing my participants, like, of course, it's not a part of the formal interviews, but we would talk and chat. And then like some of them would share that how can I maintain this like spousal relationships, not just caregiver, care receiver. And as I think when it comes to dementia as a progressive disease, it's very challenging. But I think like one of the things that my participants shared with me is to kind of like think about to acknowledge the person with dementia, and also to acknowledge themselves. And then like some also shared about the communication, and then like having kind of a communication as early as possible. And then to kind of like established a effective way of communication between the spouses. And as the disease progresses, they can still have like their own like established patterns or ways of communicating, of kind of like acknowledging each other's like efforts and commitment. And that's something that, and also kind of like, I think having like counseling or like other emotional support from family and friends, and even with peers who also like share similar experiences, that's something that's very important and could be very validating and therapeutic in the process. Yeah, that's like what some of the thoughts that I got from the participants in my study.
Thank you. Thank you. Very helpful suggestions. Sean, we did have a question that came in just specifically to you. What would be the first things to look for when touring or considering an assisted living facility?
Yeah, right. And so I don't want to sound like you know, what's the word? I'm a one-trick pony here with the same answer, but I do think it does start with that collaborative conversation with what, you know, what's most important to you, mom or dad, you know, and really trying to narrow it down. Is it meals? Is it socialization? Is it, you know, geography? Is it recreation? Everything that's important there. I think also looking at the medical need as well, because assisted livings it's more of a social model than it is a medical model, but I am starting to see that transition where assisted livings are able to perform to a certain limit some medical clinical care. It's hard to have a crystal ball and to predict the future of where mom will be, right? But I think it is, as much as it can help quality of life, as I think Rebecca mentioned earlier, one thing that negatively impacts quality of life is having to go from one place to another and over, you know, whether it's back to the hospital or the assisted living and then a long-term care and then somewhere else. It's as much as to, again, getting back to what's important to her. I think that's where you start. And then really, Rebecca gave some great resources to start research online, but ultimately I'm just a huge believer in the eye test and having your questions organized, geared toward what's most important. And you going in there and really picking, you know, 2, 3 to 4 potential places and really interviewing them. And really, in the end, having done your due diligence, I think it'll come to you what's the best feel and what'll be the best environment.
Just jumping in on that, I wholeheartedly agree, because back also with the question about a caregiver in your home, it's about a values match. So connecting with that administrator or whoever's giving you the tour and asking those questions and getting that gut feeling about what that place is going to be like, what care in that place is going to be like, what's the, you know, the mindset of the leadership of the facility. That's you know, an even better indicator, I think, of the care that you're going to receive, rather than a set of stars on a on a website. So yeah, so I wholeheartedly agree with everything that Sean said. And I just also just want to throw in there, you know, Jennifer, you're probably going to get to some of these other questions. I noticed that many of them are really about specific caregiving scenarios, and it's really about relationships. And I think that that's where talking with other people in the same situation you are will get you so much, you know, a wealth of different ideas and perspectives on how to approach those issues. And so again, I just want to reiterate the importance about connecting yourself with a peer group, with peer support, and even if you're not a joiner, to become a joiner in this particular situation that you're in at this point in your life. It's incredibly valuable. Because the answer is what works for you in your situation, and hearing a variety of feedback will help with that.
Yes, I agree, Rebecca. Thank you for sharing that. That's a great point. Caregiving can be very isolating, and just being able to share your experiences with others may help you learn that while our experiences are all unique, there are some universals as well. So, and yes, we are getting, you know, attendees are sharing their stories a little bit in some of the questions we're seeing, which is really nice. One of them is focused. So we did have someone who is speaking about a loved one who has a fixed income and lives in a low income senior housing. And so the question is, I'm considering getting her qualified for Medicaid. Are there drawbacks to being on Medicaid in terms of quality of care? And Sean, you might be a starting point for this question.
Yeah, well, so my first response is there better not be, because technically it would be against the law. So, you know, I'm a big believer in that. I could tell you, just in my environment, I mean, our caregivers and, you know, clinical leaders and social workers, everybody, they don't know what somebody's payer type is. they don't need to know, and everybody is treated the same. I think there are some maybe minor areas where it could be, you know, in an assisted living, it could say, it could result in having a smaller apartment. It could be having in a long-term care setting, potentially having a roommate. But that, that's very minor and very rare, I think, so the short answer is that if somebody is certified and licensed as a Medicaid provider, it should have zero impact on the services and care that they provide.
Agree, Sean. Sorry, Rebecca, just, I've heard that question before though, so which is really why I want to raise it up, because for whoever asked that question, you're not the only one who has that fear or that worry. So I love, Sean, that you're so clear about why that should not be the case. Rebecca, sorry, I cut you off.
No, I agree with your emphasis. I was just going to add that it can sometimes be a challenging and lengthy process to qualify. And sometimes when, let's say, you need a change in care setting, it's often very sudden, let's say as a result of a fall. And so it's part of having your ducks in a row by perhaps initiating it, that process even before the need gets to that place of where you need to make a rapid transition.
Thank you. And so as we are getting close on time, I did just want to note that another area where we're seeing our questions focus on is around those resources, wanting to learn more, appreciation for the links. So I did want to throw out there one additional resource that we have not heard about, which is 211. And so that is a number you can call 24 hours a day for access to resources as well. So now as I move us to a close, an hour goes by very fast. I have learned so much from listening to you all. Again, as we've talked about earlier, we all will have different experiences of caregiving, but I think there are things that we all can tap into. And we've heard some of those resources and recommendations here today. I want to lift up what you as panelists have woven through the conversation today is really the importance of self-care and preserving your relationship, your original relationship with the person you're caregiving, really first and foremost. And I think it's Rebecca who stated that, you're not doing this alone. You don't need to do this in a vacuum. Give yourself permission to get help, reach out to others, talk about your challenges. So I want to take a moment to thank the panel today for sharing all your expertise, the information, great resources. I also want to let the audience know, I want to thank the audience for joining us today and let you know that this webinar will be posted. It's recorded and will be posted, so you'll be able to listen again if there's pieces you want to hear again, but it's also one in a series of webinars. And so I encourage you to go, if you're looking for future events, to the webpage, which is unh.edu/alumni. And you can find recordings as well as future events. So I want to thank everyone for joining us today. And again, thank you to the panelists.